No disclosures. So the cannula has really been, to me, one of the biggest things that have evolved my practice, both in terms of the micro-disposable one for in-office filler use as well as the cannula for fat transfers. I'm going to talk a little bit about both techniques, fat and fillers. I look at them as a reflection of the same technique in the sense that I believe that we can achieve a lot surgically, but there's going to be some level of resorption. There are going to be some things you just cannot achieve with fat transfer. And I tell every patient, whatever I achieve for you surgically, as an office-based treatment, I can finesse it. And so I think it's important to understand that as you've heard, the difference between an education and an excuse. An education is told before the procedure and excuses afterwards. And these cannulas really help facilitate vascular preservation and safety. So we always know about the aging of the face being this volumetric collapse, but what exactly is it? I want to create a paradigm to help you think about this in a very logical and hopefully artistic way. So we start with this circle. So it's about the halos or circles around the face. And instead of just thinking about the frontal cheek area, it's really about circles in the perimeter. It's the transitions, it's the total facial shape. And that really provides an aesthetic frame to the face in a beautiful way. So when you start to see this photo again, you start to see that involution around these circular elements. And you've always heard that we change from a upside down egg to a right side up egg. And for the face, it really does work, and it really works on the perimeter more than anything else. And so I want to talk about really defining these three elements that on a schematic involves, if you think about between 1 and 2, is that zygomatic convexity, and above and below it there's two paired concavities, and that those concavities are critical to address. It creates that subliminal feeling about a face when you connect those two concavities and bridge that convexity. And I think it's very important when you show your before and afters, when you look at a person, is to look at the frontal view, because that's how we relate to each other on a social, professional level. So the only X part, unless the person is very thin, is the zone. And so if you're doing it non-surgically, you're doing botulinum toxin for masseter reduction. If you're doing it surgically, we're talking about a face or neck lift for that component. So how do you do it? If you're doing fat transfer, the temple, it's pretty standard. You go up and fill the temple. And then if you're filling this area below the arch of the bone, you're going I usually enter from a point in the medial direction. And then to fill the area around the chin area, you're just filling it from that point behind the pre-jowl. With fillers, you're filling it very similarly, but I like to go laterally. Since I'm just standing lateral to the patient, I can easily fill it. A couple things that are very interesting is that when you look at the temple, it doesn't just end at the hairline. You know, depending even if someone's got alopecia or not, the temple is a visual extension that goes all the way behind the hairline. So when you're looking for that concavity from an aesthetic level, look at what level the area behind the hairline has to play. So you're going to teach your eye to start seeing that the extent of the temple is actually much more significant in many people than you would otherwise think. So that's very, very important. And I've really moved away from the anterior cheek, and the real reason for it is you see these people walking around with too much in there. So what's interesting is that, and I really believe that fat has too good a survival in the anterior cheek. It just does too well there. And I was using 1 cc of fat. I mean, things that people would laugh as being too little, you know, it's 1/5 of a teaspoon, and I found it was still too much. So now when I do fat, I put nothing in the anterior cheek. That almost sounds like heresy, but to me it's heresy to put fat in the anterior cheek now. And fillers, I almost put usually nothing in the anterior cheek. An area that everyone loves to put in, I hate it, it doesn't look right. But when you start to look at the outer edge of the perimeter of the face, I really think you can achieve better results that are really beautiful. For me, let's go back and focus to me what is the most important element of the entire face, which is the eye, because that's where we're interacting on a social professional level. And so a lot of women come to me, they're focused around their lips and their mouth, which are important. Now, if their neck is sagging, you can do so much around the eyes, they're not going to look that much better because you need to create a balanced result. But when you look at the eyes, that's where people are interacting. So I've come up with this model in the last year of thinking of the circle more like two asymmetric triangles. So we all know about the long limb of the inferior portion, which is the tear trough, but don't forget there's that lateral canthal extension that goes up. For the superior rim, you're looking at not just that lateral brow highlight, but what we call traditionally that A-frame deformity, to me is actually superseded the importance of the lateral brow. And the reason for this is that that lateral brow looks like it's sagging, right? And if you inflate that by itself, it actually makes the lateral brow look more hanging. But if you just fill a little bit in the inner brow, it takes the sagging diagonal look and frames the eye in a horizontal fashion that's very pretty, very beautiful, and it's good for men and women. So it's very hard to convince someone that you want to fill the brow and make them look heavier when you actually are inflating it and making them look younger. I liken it to like a balloon that deflates, and when you fill it back, it has this really beautiful contour. The lateral brow, I'm actually becoming much more gun-shy to put too much because it can look too Neanderthal. So I'm actually quite conservative, and when I do fillers, I may just do the inner brow. When I do fat, I do the whole thing, obviously, because they're there, and I just put a little bit laterally. So think about that framing. It's so important to fill it. How do you do it? Well, it's a little bit different with fillers and fat. With fillers, I have different entry points as I go up. For the fat, for the lower eyelids, you've heard in the textbook that it's a vertical direction, otherwise you're going to create sausage appearances in the lower eyelid. This is something everyone knows about by now, so I'm not going to belabor the point. Fat, I find that I've had some tracking issues where I could see a little of the fat when I went through a separate brow incision, so I just go lateral to medial with an emphasis medial rather than lateral. With fillers, I can finesse that fat result, where instead of putting a lot into the lateral brow, what I'm looking for is that transition point where the bony brow begins to dip into the lateral canthus. And so sometimes you don't even need to fill the lateral brow with fillers. You can just go and just touch that little transition point where the lateral brow sinks into the canthus, and bam, it looks better. So I'm really obsessed now with connecting that lateral brow bone into the canthus and then helping soften that canthal depression. Those are two areas that I'm very, very, very obsessed with. Another adjunctive component that really only applies to fillers to me now is something I thought about in the last 2 or 3 months. So this is something I just gave a mini talk about last night, but it's about understanding that when you fill the orbital rim, you're still missing that hollowness going from the orbital rim to the ciliary margin. In fact, not only are you missing it, you accentuate it sometimes, and the person still doesn't look quite right. Or you fill the orbital rim enough, and then they still have a depression that just doesn't look right. So what I've been doing now is I don't do this with fat. I think it's not a good idea to put fat that close to the eyelid margin because it can start showing up. But just layering a very gentle HA product near the eyelid. If you said, are you going to get Tyndall effect? I'm not putting a lot in, and I'm being extremely slow. This is a very slow process where I'm layering it horizontally right up to the ciliary margin, and I'm seeing this transformation of the eye that's really, really pretty. And just for around the mouth area, there isn't anything too sophisticated, although I would attribute a lot of the thinking to Val Lambros about the importance of that canine fossa near the mouth. So if I'm doing just fillers, I'm just hitting that area and making sure that transformation is really nice. When I'm doing fat, I'm actually filling the entire nasolabial recess all the way down. And so this is just a conceptual element, and hopefully also a technical one that makes sense to you. So this is, people think, 30 syringes of fillers is insane, but it's not overdone if you don't do a lot in the anterior cheeks or lips, in the problem zones, I would call. And this is a lady that's that last one's a filler. This is a fat transfer, very subtle, not aggressive. This is another fat transfer, just softening and blending in all the places. You can see I could have done more than posterior hairline to blend. It's my staff members. This is a filler result, about 20-some syringes done over a few years. There's a fat transfer as well as some laser therapies for the skin. This is a lady that's 36 on the left, 42 on the right. This is fillers done over many years, and it's about 30 syringes done slowly over time. This is a lady that had a rhinoplasty, fat transfer, facelift, eyelid, and laser resurfacing, so you can really combine multiple techniques. This is a lady that's had an overdone eyelid procedure, and she's 53 on the right, she's 53 on the left and 60 on the right, so gradually inverting that V shape. This is a lady who has overdone lips by someone else, and this is, I know, a little bit more makeup, I apologize for that. She was doing a TV show with me. And this is just reshaping that perimeter. That's so very, very important, and then rebalancing her lips. This is a lady that's actually gained about 10 pounds on the right, but she looks thinner because she's had Botox, jaw slimming, and 1 round of filler, so it's not as perfect as having done multiple rounds. And I always encourage my patients, don't look at this as a 1 fill round. We've got to fill things. So even with fat transfers, I tell them, look, we're going to do a little fillers to balance and improve it. With fillers, I'm going to say to create some durable longevity, even with what's known as temporary fillers, I really believe you can achieve that. Just like with botulinum toxin, with repeated dosing, it starts to last years and decades when you build it appropriately. So one thing I end with all my talks is to encourage you to start looking, because the more you look as an artist, the more you develop new ways of seeing. The more ways you develop new ways of seeing, it feeds into both your surgical and your non-surgical practice. Thank you.